And thank you for those very, very kind remarks. And a big thanks to the National Foundation for Infectious Diseases for this incredible honor. It is truly an honor to share an evening with Ann Gershon and Jeremy Farrar. So thank you for that as well. Ann mentioned the thing about singing, and I was here last year and heard Ann's show tunes, which were really incredible. Given that one of the main areas of focus of the Robert Wood Johnson Foundation is on promoting health and well-being, I will not put you through that tonight. I am incredibly thrilled to have my wife Jeannie here tonight. She has been my partner through my entire career. She has carved her own career as a food writer during this time. Infectious diseases played, though, a critical role in our romance, and Ann didn't mention that. It was an outbreak of hemolytic uremic syndrome, E. coli 015787. It was my first outbreak as an EIS officer at the CDC, and I was sent up to Boston to figure this out, and we did. But one of the things about this outbreak that was really incredible was my sister was living in Boston, and she introduced me to Jeannie, who was working in Boston at the time. And while we figured out that the outbreak was due to fresh pressed apple cider in probably about 3 weeks, somehow we convinced the folks at CDC to let me stay there for about 3 months. And at the end of that, it was love at first sight with Jeannie, but at the end of the 3 months, she moved back to Atlanta with me, and I think it was the only outbreak, or the first outbreak in CDC history that led to a marriage, which was incredible. So thank you, Jeannie. I also want to thank Matu Santosham, who's here tonight with his wife, Pat. When I was a resident in pediatrics at Johns Hopkins, I went to Johns Hopkins because I wanted to be at a place where people were trying to tackle some of the world's biggest health challenges. And I couldn't think of a better place to do a pediatric residency. On my first rotation in the infant ward, Matu was the attending, and he would spend a month attending every year from his work at the School of Public Health. And he talked to me about the work he was doing on diarrheal diseases in Bangladesh, and as well as on the White Mountain Apache Reservation in Arizona. And I said, this is who I want to work for. This is what I want to do. And I met Matu and got to know him and went to his office, and I said, I want to work for you in 3 years when I finish my residency. And we stayed in touch, and he gave me my first job right out of residency, working for him in Dhaka, Bangladesh, studying the impact of acute diarrheal disease on seroconversion to oral polio vaccine. The study was a total bust, but the experience was incredible, and we were just talking about that. The experience was incredible, and it's one of the ways I fell in love with public health. And it's incredible how these threads run through your life. So I met Matu, and that got me to Dhaka, Bangladesh. And in Dhaka, Bangladesh, I met Boris Lushniak, who is here tonight as well. Boris was an EIS officer at the time. He was studying the spread of measles through refugee camps in Dhaka. And he told me about the Epidemic Intelligence Service. And we became really good friends. It was 30 years ago this month that we met in Dhaka. And we stayed in touch. He told me about EIS, and I decided, wow, when I come back, that's what I want to do. So it was because of Matu, and then leading to Boris, that led to Jeannie, which tied it all together. So I want to thank them for being here and for that role in my life. I want to say I feel like a bit of an interloper here tonight. I have no training in infectious diseases. I don't have a fellowship in infectious diseases. I did infectious disease epidemiology during my time at CDC. But I'm a general pediatrician. I still practice general pediatrics. But there was something about infectious diseases that I just found amazing. there was something about the social justice aspect, the equity aspect of what you do in infectious diseases and what I was able to participate in infectious diseases. The types of interventions that so many of you in the room were responsible for. Vaccines that are now universally given, that don't discriminate based on age, that we're trying to get to every part of the world. Oral rehydration solution, which costs pennies, which has saved millions of lives. These kinds of things I see as tools of social justice, and I see infectious diseases as critically important to that. The role I currently play as president of the Robert Wood Johnson Foundation, we don't work on infectious diseases. And when Marla Dalton, Marla, thank you for what an incredible evening. When she told me that I was being given this award, I said, well, I want you to know that we don't really do infectious disease work at the Robert Wood Johnson Foundation. What we're focused on is this big audacious goal of what we call a culture of health. And it's really trying to create conditions in America that allow people to lead healthy lives. And it's looking at the conditions where we live, where we work, where our kids learn and play, and making sure that everyone in America has a fair and just opportunity for health and healthy choices. There is a tie-in to infectious diseases, and I think in the world of infectious diseases, we have to look at who is still getting infectious diseases disproportionately to their representation, who is not benefiting from all of the interventions and work that you have brought forward. There are issues of health equity that we have to keep asking and interrogating our work so that everyone is benefiting fairly from what we're doing. To think about a world in which everyone has a fair and just opportunity to be free of the fear of infectious diseases is about what people in this room are engaged in. And I've been really thrilled to be able to be involved in that during my career. So thank you for what you do, and thank you for letting me be part of your community, and thank you for this really wonderful honor.